The metal tray hit the floor like a gunshot. Brooke Sullivan flinched. Just barely, a tightening at the base of her skull, a muscle memory that wouldn't let her forget. She'd learned to make the flinch invisible, small enough that nobody watching would catch it, but her hands knew. Her hands remembered the sound of incoming fire, the smell of cordite in the ticret dust, the weight of a man bleeding through her uniform. She kept walking. The ICU corridor at Mercy General stretched before her like a tunnel of fluorescent white, the antiseptic smell so thick it coated the back of her throat. Oversized scrubs hung loose on her frame. She'd ordered them deliberately a size too large, the kind of choice that let her disappear into hospital walls. Her name badge read B. Sullivan, RN in plain block letters. No middle initial. No history. Just a quiet nurse moving through evening rounds with the mechanical precision of someone who'd learned to be forgettable. 6 months at Mercy General. 6 months of moving through these corridors without being noticed, without being asked questions, without anyone mentioning the faded unit patch sewn inside the lining of her jacket, the one she touched like a talisman during night shifts when the fluorescent lights buzzed their relentless hum and the monitors beeped out their rhythms like counting down to something she couldn't name. She'd left the Navy as a senior chief petty officer when the PTSD made every loud noise feel like an explosion waiting to happen. The military had offered her medals and gratitude and a medical discharge and the advice to find peace. So she'd chosen a small city hospital in Houston where nobody knew her name, where the work was honest and quiet, where she could spend 12-hour shifts healing people without anyone asking her to tell them a story she'd spent 3 years learning how to forget. The elevator doors opened to ICU Level 3 at 1953 hours. Habit made her mark the time. The unit was quiet, the kind of quiet that came just before evening shift change, that suspended moment when day nurses were finishing their charting and night nurses were reviewing patient files, the hand-off point where attention scattered like light through a prism. Brooke pushed the cart with medications and fresh for supplies, her movements practiced and economical. Room by room. Bed 1, post-op cardiac patient, stable vitals, monitor displaying a strong sinus rhythm. Bed 4, pneumonia case, oxygen saturation climbing back toward normal. Bed 7, elderly trauma patient sleeping through the pain medication, her breathing steady and deep. And then Bed 12. The seal in Bed 12 had a chart that read like a casualty report. Traumatic brain injury from a blast in Kandahar, shrapnel fragment lodged near his temporal lobe. They'd stabilized him, but the damage was extensive. Some things the brain doesn't recover from. Some things leave you a different person on the other side, if there is an other side. He'd been unconscious for 43 days. The doctors used words like persistent vegetative state and minimal consciousness and may never regain full cognitive function. Brooke checked his full line first. The needle was clean, the flow rate correct, the saline running clear. She adjusted the rate with 2 fingers, a precise movement requiring no second attempt. Her hands knew this work. Her hands had done this work in sandstorms with penlight and prayer, with the ground shaking from mortars for blocks away and a man's blood soaking through her uniform as she worked to keep him breathing until the Black Hawk came. She paused at the bedside, her fingers unconsciously reaching for the edge of his blanket. The fabric was rough hospital cotton, industrial grade, designed to withstand endless washings. She straightened it carefully, tucking it in with the kind of care that suggested tenderness, though her face remained neutral, the flat, professional expression of a nurse completing her duties. His forearm lay across the blanket. She saw the tattoo clearly in the fluorescent light, 2 lines of text in military Gothic script, the kind of permanent mark a man gets when he wants something to survive even if he doesn't. B. Sullivan was the name. Beneath it, Ticret, 2011. She didn't allow herself to react. Didn't allow the recognition to cross her face, didn't allow her hands to shake or her breathing to change. She simply straightened, checked his chart one more time, and moved to the next bed. This was a skill she'd spent years developing, the ability to compartmentalize, to lock down emotion, to be present in her own body without being present in her own mind. Her hands were steady. That was what mattered. The evening shift change happened at 8 p.m. hours exactly, and that's when Dr. Sterling appeared in the ICU like a man who'd learned to materialize exactly where he wasn't wanted. He was tall in the way that expensive tailoring could make anyone tall, a charcoal suit that probably cost more than Brooke's monthly rent, a watch that caught the light like a weapon, shoes polished to a mirror shine that suggested someone else did his laundry. His smile was the kind of smile that hadn't reached his eyes in probably a decade. "Sullivan," he said. Not a greeting. A statement of fact, like reading from a chart. "Dr. Sterling." She didn't raise her eyes from the medication log she was finishing. He'd been watching her. She knew this the way prey animals know they're being tracked. The sensation had been building for 3 days, her awareness of attention, the feeling of eyes on her back during shift changes, that specific pressure in a room when someone decides you've become interesting. She'd made a mistake. One mistake, 3 days ago, while filing charts in the physician's office during her break. She'd been organizing billing records, a task that should have been automatic, thoughtless, the kind of work that didn't require analysis. But her eyes had caught on something wrong. A procedure code for a cardiac ablation, billed to Medicare on March 15th. She'd flipped back through the records. The same patient. For procedures in a single week. All coded for treatments that required surgical intervention. All coded for Mercy General. All billed at $17,000 each. She'd checked the patient chart. The man had been in the ICU for respiratory failure. He hadn't had cardiac surgery. Hadn't had any surgery. Hadn't been cleared for any surgery. Brooke had put the records back. She'd finished her break. She'd returned to her shift. She hadn't said anything to anyone, had filed the observation away in the same mental compartment where she kept all the other things she'd learned not to speak about, the wisdom that came from knowing that some fights you couldn't win, that speaking up cost more than silence did. But Dr. Sterling had been in the office when she was there. She'd seen him watching her from the doorway, seen the moment his expression changed, the instant when he realized she'd seen something she shouldn't have. "You're looking well," he said now, and his voice sounded like a tank idling in a garage, something heavy with barely contained power, capable of moving forward and crushing whatever stood in the way. "Thank you, Doctor." 6 months of practice made the deferential tone automatic. Senior Chief Petty Officer Brooke Sullivan had commanded 23 sailors and made decisions that kept men alive under fire. Nurse Brooke Sullivan kept her eyes down and her voice soft and her shoulders small. "I was wondering," Sterling continued, "if you'd thought about your long-term plans here at Mercy General." She looked up then. Just briefly. Just enough to meet his eyes and see the thing moving behind them, calculation, the kind of careful assessment a predator makes when sizing up whether prey is worth the hunt. "I'm satisfied with my position," she said. He smiled. This time the smile did reach his eyes, but it brought nothing good with it. "I give you a week," he said. "Before you realize you're not cut out for this. Before you run back to wherever quiet people go when they figure out they don't belong in real hospitals." He said it loud enough for the other nurses to hear. Loud enough for the attending physicians clustered around the central station to pause in their conversations. Loud enough for the words to hang in the air like a wager, like a dare, like a promise of something he intended to make true. Then he was gone, walking away with the confidence of a man who'd never encountered a consequence for anything he'd ever done. Brooke stood at the medication cart, her hand still resting on the metal surface. The cart was cold beneath her fingers. Real. Present. Anchoring. She thought about the tattoo on the SEAL's arm, her name in permanent ink, marking him as hers in some way that time and injury and unconsciousness couldn't erase. She'd spent 6 months trying not to exist in Houston. She'd spent 6 months making herself small, forgettable, invisible. The next word she heard came from the charge nurse, who'd been standing close enough to catch the full weight of Sterling's comment. "Don't let him get to you, Marcus," the day shift charge nurse said quietly. "He does this with new staff. Tests them. Some people break fast. And the others?" Brooke asked. Marcus hesitated. "The others learn to keep their heads down and not look at things they're not supposed to see." She nodded like she understood. She did understand. She understood perfectly. The question was what she intended to do about it. But that was a question for later, a decision she could postpone until she'd figured out exactly what kind of nurse she was going to be at Mercy General, the kind who stayed quiet, or the kind who stayed sane. For now, she had evening rounds to finish. She had vitals to check. She had a Navy SEAL in bed 12 with her name tattooed on his arm and a traumatic brain injury that might have stolen every memory of her. She picked up the medication cart. Her hands were steady. That was all that mattered. Her hands were steady. That was all that mattered. Brooke Sullivan moved through Mercy General's corridor at 0630 hours, muscle memory carrying her feet along the familiar path, past radiology, through the pharmacy corridor, toward the physician's lounge where coffee was already brewing. She'd been at the hospital 6 months, long enough to know the rhythms of shift change, long enough to understand the silent hierarchy of scrubs. Nurses moved through the hospital like currents around rocks. Doctors were the rocks. The lounge door stood half open. Dr. Sterling's voice carried through before she could pass. "I'll bet anyone here $50 that Sullivan quits within a week. These quiet types always break." His words had the precision of a scalpel, deliberate, aimed, designed to wound without leaving visible marks. 3 physicians laughed. 2 didn't. The sound reached the adjacent break room where 3 nurses stood refilling water pitchers, and Brooke heard the shift in their conversation, the sudden awkward silence that meant the words had traveled exactly where Sterling intended them to travel. She kept walking. But her hands trembled as she set down her tablet at the nurse's station. Not visibly. Not enough for anyone watching to catch the tremor in her fingers. The involuntary kind of shaking that comes from restraint, not fear, the kind that lives in people who've held weapons and held dying soldiers and held their own tongues for longer than most people know how to stay silent. She steadied her breath. 1 inhale through the nose. 1 slow exhale through the mouth. The same technique she'd used in Tikrit when the air turned orange with dust and bullets were the only sound that mattered. 2 days passed like that. Small humiliations, the kind that accumulated like carbon build-up on an engine, a condescending comment during rounds, a dismissive laugh when she suggested a medication adjustment, Sterling's habit of speaking to her without making eye contact, as though she occupied less space than the oxygen she breathed. Wednesday afternoon. Lunch rush. 50 conversations layered over the clinking of silverware and the hum of refrigerators. Brooke navigated between crowded tables, her tray balanced against her hip, sandwich, apple, black coffee. The cafeteria smelled like industrial bleach underneath the food heat, a smell that would never quite disappear from hospital tile no matter how hard maintenance scrubbed. Dr. Sterling stepped directly into her path. "Excuse me, doctor," she said quietly, moving to the right. He moved with her. She moved left. He mirrored the motion with the casual deliberation of someone playing a game he'd already won. The tray wavered slightly in her hands. He smiled. Then his forearm came up and struck the tray from below, not hard enough to be assault, just hard enough. The sandwich tumbled upward, the apple caromed off a water glass 3 tables over, coffee arced across the white tile floor in a brown splash that sounded like applause for 30 meters in every direction. The cafeteria went silent. 50 conversations stopped as though someone had cut the audio track. Sterling tossed the patient chart at her feet, the pages spreading across the floor like a fractured bird. "Pick that up, sweetheart," he said. "Unless you're too delicate for actual work." The silence was the worst part. Not his words, not the food scattered like casualties, but the collective inhalation of 50 people pretending not to watch her humiliation unfold in real time. Brooke felt 1 tear escape, just one, the kind that comes from pressure rather than emotion, the body's way of releasing what the mind refuses to acknowledge. She wiped it without breaking eye contact. Her voice, when it came, barely traveled beyond the radius of his hearing, but it carried like a radio frequency cutting through static. "I've stood in places where better men than you tried to break me, and I'm still here." She bent down. Picked up the chart first, that was the important part, the professional part, the part that said his authority still mattered even though it didn't. Handed it back to him with steady hands. Then collected her lunch piece by piece while he stood there watching, waiting for the collapse that never came. She scraped the apple off the tile. Wrung out napkin soaked with coffee. Never looked away from the task. When she finished, she stood, the ruined lunch cupped in her hands, and walked to the trash bin. Behind her, Sterling didn't move. No triumphant laugh. No follow-up cruelty. Just the sound of her shoes against the tile, each step a small victory that only she could hear. That night, she found her locker open. Quitter, written in black marker across the inside of the metal door. The handwriting was crude, deliberately crude, the kind meant to plausibly deny any authorship. She photographed it with her phone, documentation, the same way she documented every medication delay, every lab result, every patient assessment for 6 months. Evidence without emotion. The nurse's version of a threat assessment. The next morning, rumors moved through Mercy General like a virus. Sterling was calling her the delicate one in every department meeting. A fabricated note about a medication delay appeared in the electronic health record, a medication she hadn't touched, signed with a timestamp that contradicted the patient's own notes. Another report surfaced about charting errors from 3 weeks prior, errors she didn't make but that bore her signature nonetheless. Sterling was building a file. Building a case. Building the institutional justification to remove her without ever mentioning the real reason, that she'd seen what he'd done and had the credibility to prove it. Brooke checked on bed 12 during her shift. The Navy SEAL, Petty Officer Marcus Webb, according to his chart, lay watching his own forearm with an expression caught between frustration and exhaustion. The tattoo was there in military stencil font, dark green ink faded by years and sun exposure, B. Sullivan. His brow furrowed as he stared at it. His lips moved silently, the way mouths move when they're trying to access a memory that's locked behind a door the brain forgot how to open. Traumatic brain injury didn't care about rank or service or the fact that memories existed somewhere in the architecture of his mind, inaccessible but present, like a book written in a language that no longer existed. He looked up as she approached. His eyes held no recognition. But his hand moved toward his forearm instinctively, a gesture that suggested the skin remembered what the mind could not. "How are your pain levels today, Petty Officer?" she asked, keeping her voice steady, professional, the careful neutral tone she'd perfected over 6 months of working under Sterling's microscope. "Like something's missing," he said quietly. "Like I should remember something. But it's just gone." She documented his vitals without comment, her handwriting precise, each number exact, blood pressure 118/76, heart rate 72, temperature 37.1 Celsius, oxygen saturation 97% on room air. Normal. Stable. The body healing while the mind remained a closed circuit, information surviving somewhere in the synapses but separated from consciousness by a barrier that medicine couldn't penetrate. That night, Marcus Webb's chest wound began bleeding. Brooke noticed the first signs during her assessment at 2,200 hours, the dressing slightly discolored, more than the normal seepage that occurred during healing. She paged the on-call physician. Dr. Marcus Chen, an internist with 6 years of experience and a reputation for taking a measured approach to complications. 30 minutes passed. No callback. She paged again, adding a note to the system, increased wound drainage, patient stable but monitoring closely. Another 40 minutes. Nothing. At 2,310 hours, Brooke returned to bed 12 and found the dressing saturated. The blood wasn't spurting, which would have indicated arterial hemorrhage, but the steady ooze of something deeper, something internal deciding to leak out through the reopened surgical site. She checked his blood pressure. 118/72. Still acceptable. Still in range. But his heart rate had climbed to 86, then 91. His skin felt cooler than it had 2 hours prior. She initiated the rapid response protocol, a clinical escalation that meant the hospital's most senior physicians would converge on bed 12 within minutes. She knew what she was triggering. She did it anyway. Dr. Sterling arrived first, followed by 6 specialists who moved around Marcus Webb like white coats assembling for a funeral. The thoracic surgeon, Dr. Halloway, a man who'd published 17 papers on complicated cardiac repairs, examined the wound without touching it. The chief of surgery appeared, a woman named Dr. Reeves with a reputation for precision and a consulting fee that started at $500 per hour. 2 internists. A cardiologist whose name Brooke didn't know. A pulmonologist. 7 doctors. 1 patient. 1 wound that was slowly but persistently bleeding. Sterling reviewed the monitors with the practiced detachment of someone who'd already reached a conclusion. He pointed at the coagulation factors, PTT slightly elevated, INR trending upward, signs that the body's clotting machinery was struggling under the burden of whatever was happening internally. The specialists examined the surgical record, traced the previous repairs, located the anatomical complexity that made a second intervention a nightmare of risk and complication. "This patient's internal bleeding is too extensive," Holloway announced, his voice carrying the finality of a man accustomed to being right. The previous surgical repair was compromised. A second operation would cause more damage than the original injury. "I won't operate on a futile case," the cardiologist said. "Not a question." A statement of professional ethics disguised as medical judgment. The pulmonologist nodded. The internists exchanged glances that communicated agreement without words. Dr. Reeves, the chief of surgery, stood quietly for a moment, then wrote something in her notes. A clinical justification. A paper trail. A reason to let a patient bleed out while 7 physicians watched and documented his decline. "This case would devastate our department's mortality statistics," Sterling said, making notes. He wasn't looking at Marcus Webb when he said it. He was looking at a spreadsheet that existed only in his own mind, metrics and outcomes and the invisible architecture of a surgeon's reputation built on successful cases and the careful avoidance of failures. "We've done everything medically reasonable," Reeves said. 5 words that meant we've decided you're not worth saving, and we're going to sleep well tonight because we have colleagues who agree with us. Brooke stood at the foot of bed 12, watching Marcus Webb's oxygen saturation drift downward. 98%. 97%. The monitor displayed each digit like a countdown, each number a step toward a conclusion that 7 educated men and women had already decided was inevitable. "He's getting worse," she said quietly. Not a question. An observation. The kind of clinical observation that should have triggered reconsideration, that should have made someone look up from their notes and think, perhaps we should look again. "Then make him comfortable," Sterling replied, already turning away. His hand had moved to his pocket, where his phone was probably already receiving messages about the next consultation, the next patient whose mortality statistics were far more acceptable. 7 physicians have assessed this patient, Nurse Sullivan. "We're done here." The 7 doctors filed out like pallbearers leaving a grave. Brooke remained at the foot of the bed, listening. And that's when the real nightmare began. The lung sounds. She heard them in the silence after the doctors left, or rather, she heard the absence of them. The left side. Absent. No whisper of air moving through the bronchioles, no subtle hiss of breath traveling through tissue. But the trachea itself seemed displaced, shifted slightly, a deviation that only 7 medical specialists had completely missed or chosen not to acknowledge. Tension pneumothorax. A collapsed lung. Air accumulating in the pleural space. Not chronic. Not something that would show clearly on the chest X-ray they'd taken 12 hours ago. Something acute. Something developing in real time. Treatable. Fixable. Fatal if ignored. She looked at the forearm with her name tattooed there. At a debt she couldn't remember giving and he couldn't remember owing. At 7 physicians who decided that statistics mattered more than the patient in front of them. At a ceiling full of fluorescent lights humming their endless electric song, indifferent to everything happening below. The ICU fell into the quiet chaos of shift change. Nurses clustered at the station trading reports, voices low and practiced. Doctors moved between conference rooms and patient floors, the controlled frenzy of 7 p.m. when the day team was leaving and the night crew was arriving. Brooke Sullivan pushed through the double doors into the corridor, still hearing Dr. Sterling's voice from the lounge, something about the Sullivan situation, how she was so emotionally unstable, how she needed to be managed. She tuned it out the way she'd learned to tune out incoming fire, acknowledgement, then focus. Only the mission mattered. Petty Officer Marcus Webb was sitting up in bed 12 when she entered, and that was wrong. His breathing had changed, shallow, rapid, the cadence of a body in distress. The monitor showed his oxygen saturation at 84%. It should have been 96. His chest dressing was soaked through with fresh blood, the white gauze now rust-colored and heavy, and his eyes held that particular kind of panic that came from knowing something was broken inside you but not having the language to explain it. "Petty Officer," Brooke said, her voice level, no alarm, no rushing. The kind of calm that comes from having already survived the worst. "I need you to sit forward for me. Small movements. Can you do that?" He nodded, struggling forward, his jaw clenched against pain. His ribs were taped tight. The surgical team had closed the wound 3 days ago after the IED fragment had lodged near his diaphragm. The blast had left him with fragmented memory and a tattoo on his forearm that read B. Sullivan in blocky military lettering. She never asked about it. He'd never volunteered the story. Brooke's hands moved with muscle memory older than her civilian life. She was already reaching for her phone, already paging the on-call physician. "Dr. Chen, this is Brooke Sullivan in ICU bed 12. Petty Officer Webb's oxygen is dropping. Surgical wound is bleeding. Need you here now." "No, please, note when you get a chance." The voice of someone accustomed to being obeyed. She positioned her hand against Webb's chest, feeling the rapid thump of his heartbeat against her palm. His skin was cold despite the room being warm. The antiseptic smell of the hospital, that sharp, metallic tang of bleach and alcohol, suddenly felt thin, inadequate. This man was bleeding out, and the shift change meant the floor was scattered, the physicians were transitioning, the institutional machinery that kept people alive was momentarily disconnected. The crash cart was positioned 3 feet away. She wheeled it closer, beginning the assembly with practiced efficiency. 16-gauge angiocath. Crystalloid for lines. The equipment of emergency medicine laid out like instruments in an orchestra pit. Webb's breathing had become more labored, not the sound of a man breathing normally, but the sound of a body compensating, stealing air from reserves it didn't have. "What's happening?" Webb asked, his voice thin. "Did something?" "No talking," Brooke said quietly. "Breathe. In through your nose, hold it for 4, out through your mouth. Can you do that?" He tried. Failed. His body was already beyond voluntary control. Dr. Sterling's voice echoed from the corridor again, now louder, now with an edge that suggested he was on the phone. "Yes, I'm aware this is the second incident. No, I don't think she's stable. I think she needs to be evaluated before she harms another patient." He was weaponizing the emergency itself, Brooke understood. He was using Webb's deterioration as ammunition, building the narrative he'd need when he moved to terminate her. She'd seen this play before, not in hospitals, but in military contexts where someone's career depended on appearing competent while destroying someone else's in the process. The oxygen saturation hit 82%. Then 80. Dr. Chen arrived first, moving fast, followed by a resident Brooke didn't recognize. Then came the specialists. Sterling had already activated his network, had already summoned the artillery. Within 90 seconds, there were 7 physicians in ICU bed 12's curtain space. 7 doctors in white coats with the collective authority of a judicial panel. The attending cardiologist. The trauma surgeon. The infectious disease specialist. The intensivist. The pulmonologist. The hospitalist. And Dr. Sterling, positioning himself at the head of the bed like a conductor at an orchestra. They moved through the examination with clinical precision. Listening to lung sounds. Palpating the surgical site. Reading the monitors with the gravity of men interpreting scripture. The silence between them was heavy with what they were not saying, or rather, what they were silently agreeing among themselves. "Internal bleeding," the trauma surgeon said finally, his voice carrying the weight of a terminal diagnosis. "Significant. The vessels likely opened again." Reoperation would be extreme, the intensivist added, his gaze fixed on the monitors. He's already post-operative from traumatic injury. His GCS is still compromised from the TBI. Reopening him now would spike mortality statistics, Dr. Sterling finished, and there it was. Not would be medically inadvisable. Not would risk further complications. But would spike mortality statistics, as though the number that appeared in departmental reports mattered more than the man bleeding out on the bed. The cardiologist shook his head. The damage is too extensive. Even if we got him to the OR in the next 10 minutes, we'd be looking at massive transfusion requirements, potential cardiac arrest during induction. The outcome? Futile, Sterling said. This is a futile case. We all agree. One by one, they nodded. The trauma surgeon. The pulmonologist. The hospitalist. The infectious disease specialist. The resident. The intensivist. 7 physicians, standing in a semicircle around a dying man, collectively deciding that his life was a statistic not worth preserving. Get the family on the phone, Sterling instructed the resident. Comfort measures. We need to start the conversation about what comes next. They were already turning to leave, already moving toward the curtain, already preparing to transition to whatever other patients required their attention. 7 doctors walking away from a man with their name tattooed on his arm, though none of them knew that detail, and Brooke had never told anyone, would never tell anyone, because some things were hers alone to carry. That was when Sterling noticed her. Noticed that she hadn't moved. That she was still standing at the crash cart, still positioned between him and the patient. Miss Sullivan, he said, and his voice carried the smooth certainty of someone who'd never been refused. Step back, please. We've made our clinical determination. She didn't move. Didn't acknowledge him. Her eyes remained on Webb, reading the rise and fall of his chest, tracking the oxygen sat as it dipped to 78%. I said step back, Sterling repeated, and now there was an edge to it. He positioned his body between her and the cart, not blocking her physically but making the intent clear. This is not your jurisdiction anymore. This is not your patient. This is the moment where you accept what 7 physicians have decided and retreat to accepting it. Brooke's hands were steady. Her breathing hadn't changed. The trembling wasn't fear, if it was anything at all, it was restraint. She'd stood in places where better men than Sterling had tried to break her, and she was still here. She'd walked for blocks under enemy fire carrying this man's bleeding body, and the medical discharge, the PTSD, the anonymous nursing job in Houston, the decision to sew her unit patch into her jacket lining where no one would ask questions, all of it had been about the choice to heal instead of fight. Webb's oxygen saturation hit 76%. The room was quiet except for the ventilator's mechanical wheeze and the cardiac monitor's steady, accelerating beep. Fluorescent lights hummed their indifferent electrical song. The antiseptic smell of the hospital suddenly felt like the smell of a system designed to protect itself instead of the people inside it. Sterling was still watching her, waiting for the deference he'd come to expect. Waiting for her to acknowledge the hierarchy he'd spent 6 months constructing. Waiting for her to step back and let a man die while 7 physicians protected their department's numbers. But that wasn't the worst part of what happened next. The worst part was what Brooke did when the door swung closed and all 7 of them were finally gone, and she understood with absolute clarity that she was alone with a dying patient, a decision that would either save his life or end her career, and exactly 15 seconds to make it real. The room was empty now. 7 doctors gone. 7 refusals echoing in the silence like spent shell casings. Brooke moved before her conscious mind caught up with her hands. Muscle memory took over, the kind that lives in tendons and nerve endings, forged in sandstorms and medevac helicopters where hesitation meant body bags. She didn't run. She didn't panic. She moved with the terrifying fluid precision of someone who'd already made peace with consequences. The crash cart was 18 inches away. Supplies laid out like instruments in a field surgery, gauze, syringes, the 14-gauge angiocath needle she'd need. Her hands reached, found, moved. The world compressed into a single coordinate, the second intercostal space, mid-clavicular line. Petty Officer Marcus Webb's ribs rose and fell in shallow, desperate breaths. BP already dropping. Oxygen saturation sliding toward the red zone. She didn't look at his face. Couldn't afford to. This was a body now. A medical problem with a timeline. The needle went in smooth as a prayer. The hiss came next, the distinctive sound of trapped air releasing, pressure equalizing, the pneumothorax collapsing back into normal anatomy. She heard it like a gunshot in quiet. Oxygen climbing. 88, 91. 94, his chest wall rising with actual volume now, actual air movement. The monitors beeping steadied from frantic to purposeful. Sinus rhythm. Blood pressure climbing back from the basement. Stable. She'd done this once before in Tikrit, in a compound basement with a penlight and the sound of gunfire 3 blocks away. The hands never forgot. The muscle memory didn't ask permission. But that wasn't the worst part. That wasn't even close. The door burst open 11 minutes later. Dr. Sterling. Not alone. Behind him came the hospital CEO in a charcoal suit, the chief nursing officer with her clipboard pressed to her chest like a shield, a board member Brooke recognized from the Hospital Foundation dinner photos, the one who golfed with Sterling on weekends, and a security guard with a laptop tucked under his arm, the screen dark and waiting. Sterling's jaw tightened when he saw Webb. Saw the stabilized vitals on the monitor. Saw Brooke standing beside the bed, her gloved hands already peeling away from the needle site, her scrub still wet with his blood. For 2 seconds, nothing happened. The CEO's eyes moved from Webb to the monitor to Brooke, calculating what he was seeing. The board member's hand drifted toward his phone. The security guard opened the laptop. "Conference room," Sterling said, and his voice was smooth as oil spreading across water. "Now." They didn't ask about the patient. Didn't ask about the procedure. Didn't ask about the diagnosis that 7 senior physicians had missed. Sterling steered them toward the door with a hand that barely touched the CEO's elbow, a gesture so casual it looked rehearsed, which meant it probably was. Brooke followed. The conference room smelled like burnt coffee and leather chairs. Fluorescent lights hummed overhead like insects trapped in glass. Sterling pulled up a chair at the head of the table, the power position, and gestured for the security guard to position the laptop where everyone could see. On screen, timestamp, 14 hours 48 minutes and 23 seconds. Brooke in the ICU, moving toward the crash cart. Sterling leaving. Brooke alone. Her hands finding the needle. The catheter entering flesh. The hiss that changed everything. This nurse performed a surgical procedure, Sterling began, his voice measured and reasonable, the tone of a man discussing inventory, not a life-or-death intervention, without physician authorization or consultation. The patient was stable when we departed. Vitals had plateaued. There was no acute change warranting emergency action. The CEO leaned back in his chair. The board member took notes. The chief nursing officer's face had gone the color of hospital walls. She acted outside her scope of practice, Sterling continued, and he was good at this, so good, his delivery the cadence of someone who'd prepared remarks for exactly this moment. This is a liability nightmare. If something had gone wrong, if she'd perforated the lung, if there'd been a complication, he spread his hands like a reasonable man asking a reasonable question. We'd be defending a lawsuit. Instead, we're defending her decision to perform emergency surgery without authorization. It was needle decompression, Brooke said quietly. The first word she'd spoken. Sterling didn't look at her. Exactly. A procedure that should have been performed by a physician had the clinical situation warranted it. Which it didn't. The tension pneumothorax was missed. There is no pneumothorax evident in the pre-procedure imaging. Sterling had the radiology films pulled up on his phone, ready, prepared. You acted on an assumption, performed an invasive procedure, and got lucky. That's not medicine. That's recklessness. The CEO slid a folder across the table. Termination letter inside, pre-printed, just needing her signature and the date. The letterhead read, effective immediately, separation from employment. Brooke's hands didn't shake. She'd signed deployment orders with steadier hands, sure, but those had been volunteering for things. This was different. This was being executed on institutional paperwork. The State Nursing Board will need to review this, the board member said, and he sounded almost sorry, which made it worse somehow. We'll have to file a report. You understand there may be criminal charges related to practicing medicine without a license. She understood. She signed. Her name in blue pen looked foreign, like a stranger had forged her own signature. Sterling added his own signature below hers. The witness. The accuser. The man who'd spent 6 months orchestrating her destruction because she'd seen him commit fraud. Because she was a loose end. Because to men like Sterling, anyone who refused to disappear was a threat that needed dismantling. We'll need your badge, the CEO said. Security will escort you from the building. 67 minutes later, Brooke stood at a bus stop on Richmond Avenue in Houston, cardboard box in her arms, rain turning the box soft and collapsing at the edges. Inside, a cracked ceramic mug that said "World's Okayest" nursed in faded marker, a dying succulent she'd kept on her desk for 3 years, and a photograph in a plastic sleeve, 12 faces in navy dress blues, taken in Tikrit in 2014. 12 SEALs from Charlie Platoon. She could name each one. She could name which ones were in that photo and which ones existed now only in Arlington National Cemetery, their stones arranged in neat rows under Arlington's endless grass. The rain fell harder. A bus passed without stopping. Her phone buzzed, her sister, Mom's asking where you are again. When can I tell her? She deleted it without reading beyond the first line. There were things her sister didn't need to know. There were things nobody needed to know. Meanwhile, 5 miles away at the VA Medical Center, Petty Officer Marcus Webb was wheeled into a semi-private room on the cardiac ward. The transfer had been smooth, professional. The Mercy General ICU nurse handing off to the VA team had mentioned, almost casually, that a tension pneumothorax had been identified and treated with emergent needle decompression. The VA cardiologist nodded, made a note, made no judgment. Emergency medicine happened. People got saved. That's what happened next. The transfer paperwork never mentioned the nurse's name. But that wasn't the worst part. That wasn't even close to the worst part. The worst part came 23 hours later, when Brooke returned to Mercy General, not for redemption, not for answers, just for her final paycheck, which hospital policy required to be issued in person. She'd worn civilian clothes, a faded jacket with something sewn into the lining that nobody could see, and she'd planned to be invisible. The ER was chaos when she walked through the doors. A trauma alert shrieked over the intercom. Blood and shouting and the organized violence of a resuscitation team mobilizing around a gunshot victim, a man in his 50s, dark-skinned, Middle Eastern accent cutting through the medical noise. She pressed herself against the wall near the admissions desk, invisible, waiting. Then the patient locked eyes with her. Actually locked eyes. Actually saw her. His body went rigid on the stretcher. He started shouting in Arabic, words tumbling over each other, his voice cutting through the medical chaos like a blade. The translator, a young ER tech, went pale. A Marine officer waiting for his son's X-ray results stepped closer, his entire body going still in that particular way combat veterans got still. "What's he saying?" the CEO asked. The CEO was there. Of course he was. "He says," the translator's voice shook, "he says that's the senior chief. The American senior chief who led the raid." The Marine officer's jaw tightened. "What rank did he say?" "Senior chief." "He's saying she captured him." 2014, Tikrit. And that's when the silence started. The real silence. Not the absence of sound but the presence of understanding. 50 people in that ER, patients, families, staff, physicians, all turning simultaneously, their heads moving like they'd been synchronized by a single command. Brooke stood against the wall in her civilian jacket. Still waiting for her paycheck. Still invisible. Then boots on tile. Measured, purposeful, the sound of someone walking toward a specific objective. A Navy commander in his dress blues, ribbons arranged across his chest, stepped forward from the hallway leading to the ICU. His voice carried with the kind of authority that doesn't need volume to be heard. "Senior Chief Petty Officer Brooke Sullivan," he said, reading from his phone where he'd apparently pulled her service record in the last 11 seconds, "received 2 Bronze Stars with Valor." He paused. One beat. A Purple Heart. Another pause. And the Navy Cross for her actions in Tikrit. The CEO's hand froze halfway to his coffee cup. Dr. Sterling, who'd been standing by admissions, opened his mouth. Closed it. Opened it again. Nothing came out. The commander continued, his voice carrying the weight of official record. "She carried 3 wounded personnel for blocks under sustained enemy fire to an evacuation point. One of those personnel was Petty Officer Marcus Webb." Someone whispered, "The patient she just saved." The commander looked directly at Sterling. "This woman is the reason 6 SEALs came home alive." Sterling's face went from red to white, and Brooke finally turned away from the wall, and her eyes met the commander's eyes, and something in her face shifted, just barely, just enough, from invisible to seen. The rain came down like it had a personal grudge. 2 hours after the board member had quietly ushered her out the employee entrance, Brooke stood at the bus stop on Westheimer with a cardboard box pressed against her chest. The box held everything that mattered: a cracked mug that said "World's Okayest" nursed in faded letters, a dying succulent with leaves the color of old bruises, and a photograph in a plastic frame. The photo showed 12 people in desert camouflage, standing in front of a compound wall in Tikrit. 6 of the 12 were smiling at the camera. 6 were already gone. The rain soaked through her scrubs. She didn't move to shield the box. Some things couldn't get any wetter than they already were. A city bus pulled away without stopping. She'd missed it. Another would come in 7 minutes. She could wait 7 minutes. She'd waited longer for worse things. What she didn't know was that inside Mercy General, the machinery of accountability was already turning. 42 minutes after Brooke had walked out the door, Army veteran Torres, the IT director who'd served 2 tours in Afghanistan and understood the meaning of loyalty, appeared in the CEO's office without knocking. He carried a laptop and a thumb drive the size of a thumbnail. His voice sounded like gravel in a tin can. "We need to talk about fraud," he said. The CEO looked up from his desk, coffee cup halfway to his mouth. Torres didn't wait for permission. He opened the laptop. The first file was security footage from the ICU. Timestamp, 2:14 a.m., the night Marcus Webb's chest wound had reopened. The footage showed Brooke's hands moving with absolute precision, the 14-gauge needle sliding between ribs, the catheter advancing into the pleural space. The hiss of escaping air. The patient's O2 saturation climbing from 68 to 84 to 91 in 90 seconds. The monitor finding sinus rhythm like a prayer answered. Then it showed Dr. Sterling's face as he'd returned to the room with administration, his expression hardening as he'd realized what she'd done, what he'd have to bury to protect himself. Torres clicked to the next file. Security log from 3:41 a.m. A laptop login under Sterling's credentials. A deletion attempt. Then another. Then 6 more. A digital fingerprint trying desperately to erase evidence. "Our system archives every deletion attempt," Torres explained, his voice absolutely level. "Every keystroke. Every timestamp." He knew that protocol. Which means he knew what he was doing was criminal. The CEO's hands had started to shake. "There's more," Torres said. And there was always more. He opened a second folder. "I've been quietly compiling this for 8 months. The folder contained 3 years of billing records. Procedures coded but never performed. Patient charts with Sterling's signature authorizing treatments that never happened. Medicare fraud so systematic, so deliberate, that it could only have been intentional. Dozens of false claims. Hundreds of thousands of dollars. A pattern of deception woven so tightly into the hospital's financial records that anyone auditing Sterling's work would have to ask why no one had caught it sooner. He went after a veteran, Torres said quietly. That's the moment I knew I had to move. The CEO read in silence. The rain outside hammered the windows like machine gun fire. By 6:41 p.m. that evening, the state medical board had copies of everything. By 8:13 a.m. the next morning, federal investigators had walked through Mercy General's front doors with credentials and questions. Sterling's entire network, the colleague who'd laughed at the cafeteria incident, the board member who'd supported his termination recommendation, the attorney who drafted the firing paperwork, collapsed like a house of cards in a hurricane. The board member resigned within hours. The colleague suddenly couldn't remember being in the cafeteria at all. The attorney stopped returning calls. Sterling was escorted out by security at 10:06 a.m. on a Tuesday. Same guards who'd watched Brooke leave with her cardboard box. His medical license was suspended pending investigation. His surgical privileges revoked immediately. His name pulled from every operating schedule, every consultation list, every institutional letterhead. The consequences moved with the velocity of a falling object. No appeal, no negotiation, no network that mattered anymore. 6 months later, he would teach CPR classes at Houston Community College for $16.50 an hour, demonstrating chest compressions on a plastic mannequin named Annie while former colleagues crossed the street to avoid him. He would eat lunch alone in his apartment. He would check his bank balance and watch it decrease. He would understand, finally, that some networks don't survive when the power goes out. But Brooke didn't know any of this yet. She was standing in the rain at a bus stop on Westheimer, waiting for a bus that would take her back to the efficiency apartment where she'd planned to spend the next several months applying for jobs in other cities, other states, places where nobody knew what she'd done or what she was. The bus arrived at 7:53 p.m. She boarded it with her cardboard box and sat in the back where nobody had to look at her, where she could disappear into the motion and the sound of the engine and the anonymous crush of evening commuters heading somewhere that mattered. What happened next reached her through a phone call at 9:15 a.m. the next morning. The hospital board chairman's voice was formal, measured, and apologetic in a way that suggested lawyers had written the script. Ms. Sullivan, we are calling to offer you immediate reinstatement with full back pay and a formal written apology. We are additionally offering a promotion to clinical educator with a salary increase of 20%, effective immediately. We want to assure you that Dr. Sterling's criminal referral to the state medical board and federal authorities fully protects you legally. Brooke had listened to the call with the phone pressed against her ear while standing in her apartment, the cardboard box still unpacked on the kitchen counter. What changed? She'd asked quietly. The chairman explained about Torres. About the footage. About the fraud. About the federal investigators. Brooke had felt something shift inside her chest, not relief exactly, something closer to inevitability. Of course Torres had done this. Of course the truth had emerged. Of course the machinery had turned. But she'd long ago learned not to trust machinery. Machinery broke. Machinery failed. Machinery had a way of crushing the people trying to ride it to somewhere safe. She'd asked to return to direct ICU assignment. They'd agreed immediately. 48 hours later, she'd walked back into Mercy General through the same employee entrance she'd exited from, carrying a duffel bag with clean scrubs and the faded unit patch she'd sewn inside the lining of her jacket 8 months ago when she'd been trying very hard to forget she existed. The ICU smelled exactly the same, antiseptic, coffee, the metallic bite of fluid and human suffering. The monitors beeped in their familiar rhythm. The ventilators wheezed their mechanical songs. But when she'd opened her locker, she'd found something new, a card signed by 73 staff members, and a potted succulent, green and thriving, sitting on the shelf where her dying plant had been. Someone had brought her a living thing. Someone had believed she was coming back. Marcus Webb was transferred back to Mercy General from the VA on his own request. His traumatic brain injury was resolving, the neurologist explained. Memory recovery was proceeding normally. Familiar environment sometimes accelerated that process. Brooke stood beside his bed on her first shift back, adjusting his fur line with the same quiet competence she'd always possessed. The machine wasn't interested in her past. The machine only cared about the fluids flowing correctly, the pressures holding steady, the numbers staying green. Webb's eyes opened. They tracked across the ceiling, then found her face. Then his gaze moved down to his own forearm where her name was tattooed in military-precise lettering, B. Sullivan. Something in his expression shifted, recognition dawning like sunrise, pieces of memory assembling in his healing brain like coordinates coming online. "You carried me," he said. His voice was rough from disuse, uncertain. "For blocks. Under fire. I remember your voice telling me to stay awake." Brooke felt tears move down her face. This time she didn't hide them. This time she let them fall. "And you did," she said. He reached for her hand. His fingers found hers. "You saved me twice." She squeezed back. "Just doing my job." "Both times." The ICU continued its rhythms around them, the beeping monitors, the whispered conversations, the fluorescent lights humming their endless electric song. But Brooke no longer needed to disappear into those rhythms. She'd sewn her past into her jacket lining to forget it. Now she wore it openly, the faded unit patch visible on her new ICU scrubs where the hospital had authorized military insignia for veteran staff members. Her rank was embroidered beneath it, Senior Chief Petty Officer, Sullivan. As she left Webb's room, a young nurse stopped her in the hallway. "Chief Sullivan? Can you teach me that needle decompression technique? The one that saved the SEAL." Brooke smiled. The smile came from somewhere deep, somewhere that had learned how to survive. "Tomorrow. 0600, Simulation Lab." She walked past the physician's lounge where Sterling used to hold court, where colleagues would gather to laugh at just a nurse while he built his empire on coded procedures and deleted files. The lounge was occupied now by doctors who nodded with respect as she passed. The kind of respect that can't be commanded, only earned. The kind that comes from understanding what you don't know about the people you work beside. That evening, Brooke sat in her apartment with her cracked mug filled with coffee, the unit photograph in her lap, the faded patch visible on her jacket hanging on the back of a chair. 6 of the 12 people in that photograph were dead. 2 were still in combat zones. 3 had disappeared into civilian life the way she had, trying to forget. Only Marcus Webb had carried her name forward, tattooed on his skin like a prayer, holding onto her memory even when his own mind had forgotten. She'd spent 18 months trying to disappear. It had taken one crisis, one life on the line, and 48 hours for the world to find her again. The closing frame is this: Brooke standing at the ICU nurse's station the next morning, her jacket open to reveal the faded unit patch and her rank embroidered in perfect military lettering. Around her, the hospital continues its work, monitors beeping, doctors consulting, patients recovering and sometimes not. She's writing something in a chart. A younger nurse approaches with a question. Brooke looks up, and there's no hesitation in her face anymore, no need to make herself smaller. She's been found. She's been recognized. She's been welcomed home. Sometimes the bravest warriors don't carry guns or wear insignia. Sometimes they show up to work at 6 in the morning in scrubs the color of hospital blue, and they save lives, and they ask for nothing but the chance to do it again tomorrow. If this story resonated with you, if you've ever been underestimated or counted out, subscribe for more stories of quiet heroism and remarkable comebacks. Like this video and comment below. Have you ever been misjudged by someone who had no idea what you were capable of?